Thank you all for being here today. I feel humbled to be here, to a certain extent as a spokesperson for what is happening in nursing and nursing research. And I would like to use a story of congenital heart disease as an exemplar for the story of nursing. The ESC named lecture is called the Florence Nightingale Lecture. And it is not without reason that it is called the Florence Nightingale Lecture. Florence Nightingale is considered to be the mother of nursing, and to a certain extent she should be seen as the mother of the professionalization and development in nursing, because she was the very first who realized that you only can give good nursing care when it is underpinned with data, with science, when you are using scientific methods. That is what is needed to develop the profession. And to a certain extent, the story that I would like to tell today is a story of development, is a story of growth, is a story of professionalization. And let me start with a personal story in this respect. It was in 1997. I was working as a staff nurse at a cardiac ward. And on an evening, we had a seminar given by a then new adult congenital heart disease cardiologist called Werner Butz. And at the end of his session, so he was talking about mustard, sending operations, transposition of the great arteries. I never had heard of that before. But at the end of his presentation, he concluded with the following statement. These patients do not only need medical care, but they require an interdisciplinary and multi-professional approach. And I thought, well, if this is true, then nurses should have a place in the care for congenital heart disease as well. So I went to the library, and this was the time that you physically had to go to the library. And this is what I found. It was wasteland. Nothing, or virtually nothing, was happening in terms of nursing research in congenital heart disease. And to me, that was the moment that I decided this will be my niche. This will be the field where I want to work. This is where I want to contribute to, because a lot needs to be done in this area. And the years after, I started working with master students, and in terms of their master's project, we did some studies. A qualitative study to get an understanding on what does it mean to live with congenital heart disease. A quantitative study where we evaluated the level of knowledge of these patients. And another study, rather from a health economic perspective, looking at healthcare expenditures. And this was very important for my own development, to understand what is happening in this population, what are the needs, and to a certain extent that helped me to develop the upcoming studies that I did later on, because at that stage I was thinking of doing a PhD, so congenital heart disease would be the area where I would do the PhD in. And it is when I was presenting one of these studies at the very first, what is now called ACNAP conference, at that time it was the spring meeting of the Working Group of Cardiovascular Nursing, I was presenting one of the studies there, and after the presentation someone came to me and that person said, well, congenital heart disease, this is a kind of a Cinderella phenomenon. Cinderella in a sense that no one really recognizes the importance and the value of it yet. And it's true, when you were talking with nurses at the end of the 1990s, they said, well, we have a patient with congenital heart disease once in a while, so why should we worry so much? And we knew that things would change, because if you're talking to nurses today, they will say, we always have people with congenital heart disease in our wards. And there are even wards where half of the patients are congenital heart disease patients. So that inspired me, that statement of more than 20 years ago inspired me to come up with the title of my presentation. today. So it was in 2000 I started with my PhD, focusing on quality of life. Quality of life in adults with congenital heart disease. When I defended in 2004, at that time, as far as we know at that moment, there were about 5 PhDs in congenital heart disease. So I was definitely not the only one who was doing PhD work in congenital heart disease. But still, if you see globally, at a global scale, 5 people, that's not a lot. This is adult congenital heart disease. Similar trends were ongoing in pediatric cardiology. Also there you saw more and more people taking up a PhD in the area of pediatric cardiology. So you really can say that nursing research started really late 90s and got tractions in the early 2000s. Of course, a lot has happened in the meantime. And shortly after my PhD, several people also got motivated to do this kind of research. And they approached myself and colleagues and they asked, okay, what should I do? And we thought like, yeah, who are we to say what you should do? So that triggered us to develop a research agenda for nursing in congenital heart disease. And it was published in the European Journal of Cardiovascular Nursing. And this is in fact the flow chart of the study. We first did a literature review. We wanted to see what is done by nurses in terms of research in congenital heart disease. And if we have a closer look at this, we could see that about 100 studies were published on by nurse researchers on adult congenital heart disease. 38 we could identify doing work in pediatrics. And when you look closer in the area of adult congenital heart disease, we found 9 editorials, 8 conference abstracts, and 84 full articles. And again, zooming in on these conference abstracts and the original full articles, about half of them were reviews. And I'm talking about narrative reviews, like what should the care for adults with congenital heart disease look like? Reports, like what is our opinion on the development, where should we invest in? The rest of the studies were quantitative studies, 30, qualitative studies, 12, 2 case studies and 2 psychometric studies. And when you look on the particular topics that were dealt with, 10 studies out of all these studies were on quality of life. 9 on illness experiences and psychosocial issues, 7 on knowledge and education, 4 on transfer and transition, 4 on health behavior. So you really saw what was happening, what were the topics that people were looking at. Based on what is happening, you can decide on what should the future look like. So we developed a list of potential topics on nursing research, and we did an international Delphi study. We asked experts in the field, in the global field of congenital heart disease, like, what do you think is important to do? And we also wanted to see, do we have an agreement between all the experts? And the list of topics where there was a high priority and an agreement were the following: knowledge and education, outcomes of advanced practice nursing, quality of life, transfer and transition, illness experience, psychosocial issues, pregnancies and gynecological issues, health behavior, and so on. And you see indeed that some of these topics were already addressed, other topics were indeed taken up by the future studies, by the studies that were about to start at that moment. So we really think that this research agenda has helped some people to decide what would be the topic for their study, their nurse-related study in congenital heart disease. The thing is, when you look at more closely to the kind of studies that have been conducted and published by then, most were observational studies. And we all know that to really push the boundaries of your field, you need intervention studies. You need to see what kind of interventions are effective, what is working, and so on. So on one hand, it is a bit disappointing to see that the majority of the studies are interventional studies. On the other hand, it is also understandable, and it also served a certain need. For instance, when you look at the framework for complex interventions developed by the UK Medical Research Council, they said, well, you cannot start with a randomized control trial from scratch. You need to do some preparatory work. And this is actually the framework that was proposed. And indeed, the very first stage before you start developing interventions is you need to identify the evidence base. You need to identify theories or develop theories or see what kind of theories can be used for this intervention. Then you try to get an understanding of potential processes and outcomes, and you have to model them. So to a certain extent, all these observational studies were serving this need. They provided evidence for developing the interventions and so on. So it was not for nothing that the observational studies were conducted. Of course, a lot happened in the meantime, and there are some studies that are in place, intervention studies that are conducted right now, and even some of them are finished and are published or on their track to be published. 6 areas of intervention studies in congenital heart disease could be identified. An area of physical activity, exercise training. Is this helpful for people with congenital heart disease? The area of transfer and transition. How can we support people in becoming an adult with congenital heart disease? How can we support them in moving, in transferring from pediatric care to adult care? A third domain for intervention studies, for ongoing intervention studies, is psychosocial well-being. We know that there is a relatively high degree of anxiety and depression in our patient population. This needs to be tackled, and therefore the effectiveness of interventions in this domain are in progress. More in the field of pediatric cardiology, feeding. You can imagine that a child with a congenital heart disease may have feeding problems because it already requires energy to breathe. Can you imagine that you have to breathe and to breastfeed at the same time? That is demanding, and intervention studies on that are as well. Baby massage. That's also a domain that is under study. And then finally, hospital discharge after cardiac surgery of the children. These are the 6 domains where intervention studies are conducted. Of course, there is plenty of opportunity to do more research. And what my advice would be to junior researchers who are looking for an area, I would say come to congenital heart disease and think about the following. What do we need? Of course, we need more effectiveness research. We need to see are certain interventions effective in obtaining better care for patients. But we also have to look or should use methodologies of comparative effectiveness research. In comparative effectiveness research, it is not about the question, does this intervention work, yes or no, but it is about which intervention is working for which patient in which context. And congenital heart disease is a very heterogeneous group, so we cannot consider them as one group where one size fits all. So comparative effectiveness research will be key in congenital heart disease nursing research. The global variation in outcomes, and it is by doing the approach IS studies, where the studies that were mentioned in the introduction, it's by doing these international studies at a global scale, I realized more that most of the studies are done in the global north, in high-income countries. And the outcomes in high-income countries are not necessarily transferable to middle-income or low-income countries. If we really want to make a difference, we need to get insights in what is the situation at a global scale. What is the situation in congenital heart disease nursing, congenital heart disease care, congenital heart disease outcomes for people also in middle and low-income countries? That is something we need to focus on. So to a certain extent, we don't need another single center study on a small sample. We need more multi-center collaborations where we include also countries from middle and low income level. Of course, there are also new and understudied areas. One of them is prenatal care. And this is not a new thing. Prenatal diagnosis is common practice now. But the question is, what are the care needs of mothers becoming fathers when they are diagnosed with a child, with a fetus that is having a congenital heart disease? And also, this kind of studies have been done, but now we need to translate that into interventions. We need to develop interventions to set up care provision for people prenatally diagnosed with congenital heart disease. Neurodevelopmental issues, also here, this is not a new topic, but we need to translate this. A lot of people do have intellectual disabilities. How are we caring for these special needs? And we are not doing what we should do or could do in this respect. Transition, already something that I referred to, and an area that is deep in my heart. The first studies on effectiveness of transition programs came out, more are on their way or will be published in the upcoming months, and more studies are in the pipeline. Also here, effectiveness is one thing, comparative effectiveness is the next question. Aging and frailty. This group of people are aging. More and more people are reaching their 5th decade of life, 6th, 7th, even the 8th decade of life. And to a certain extent, a large proportion of people working with congenital heart disease, we are still thinking about the babies, we are thinking about transition of care, about young adulthood, pregnancy and so on. But what is happening at the end of life? What is happening when people are aging? Do we have the tools in place? Do we have the competencies in our teams to deal with geriatric syndromes in congenital heart disease? Also, this is a blank spot. End of life, I already referred to that. The survival improved dramatically over the past decades, which is great, but still we are losing people way too early. And how can we provide good end-of-life care? We need to do our best to keep patients alive, but at a certain moment we need to realize that here we need to stop the curative part and the palliative part needs to prevail. And we should not wait until that moment before talking about what is the way to go? What do people want when the end is near? And then also organizational models. Are we ready to take the care for this growing group of people at a global scale? Programs are saturating, so we clearly need to adapt for that. Let me come to the conclusion of this presentation. I started with this slide, nurse-led research in congenital heart disease. From Cinderella to Princess. Indeed, I strongly believe that today we are no longer the Cinderella, we are the princess. But if you ask me, what is your dream? What do you wish for congenital heart disease? Well, I would like to see congenital heart disease research by nurses leading from or developing from a princess to a queen. Thank you so much for joining me in this Florence Nightingale lecture, and thank you again to the ESC for selecting me for giving this presentation. Thank you so much.
Thank you so much, Philip. Now, before we move to our open discussion and opportunity for you to ask Philip questions, which I'm sure you have many of, we would like to invite you to come to the centre of the stage so we can present you with your award.